topping the news tonight. It's been 1 week since classes resumed at the University of Alabama. Tuesday, UA system released its first COVID-19 numbers among students, faculty, and staff. According to the dashboard, 358 students and 140 faculty and staff members have already tested positive for COVID since returning to campus from winter break.
I think that we've kind of been anticipating this since prior to the end of last semester. Omicron started to make its appearance in other places in the country, so we were already anticipating a rapid spread once students returned to campus.
With students returning to in-person learning inside classrooms, UA Health Center Director Dr. Karen Burgess says it's more important now than ever for everyone to mask up.
Omicron is much more infectious and contagious than prior variants, so it's even, if you could say that it's even more important that we wear a mask and we practice appropriate social distancing and we stay home when we're sick.
Students and employees exposed to COVID or showing symptoms should call the university's COVID-19 hotline.
348-CV19, and that number is accessible to our faculty, staff, and students. And we have in our protocols that when somebody knows that they test positive, whether it's here on campus or at an external site, that they call that line so that we can give them the proper advice and do our mandatory reporting to the state.
Dr. Richard Friend is Dean of the College of Community Health Sciences. He says, like every other entity in the world right now, the university's hotline is also experiencing challenges due to Omicron.
And so we're seeing more positive cases than we have before. Our hotline is getting over 500 calls a day, and in an 8 or 9 hour period. We've added some extended hours. We've added some more personnel. But it is very challenging for us right now to meet all of the needs of our faculty, staff, and students, but we're doing the best that we can as quickly as we can.
And Friend says that Omicron is so contagious that it can't be contained, so it's changed how the university contact traces.